Hi everyone, I am Dr. Sandeep Vaidya, Pediatric Orthopaedic Surgeon at Pinnacle OrthoCentre Hospital. It is a pleasure to be speaking with you today about a very common topic, and that is fractures in children. Children, being naturally active and playful, are unfortunately prone to falls and injuries. A fracture is simply a break in a bone. It can range from a small crack to a complete fracture. Now, fractures in children are extremely common. In fact, a large study showed that almost 75% children sustain at least one fracture by the age of 16 years. Now, because children's bones are still growing, they can sometimes fracture in unique ways compared to adults. But regardless of the type of fracture, for parents, it is essential to know how to react when you suspect a fracture. So firstly, let's talk about the do's. What do you do when you suspect a fracture? First and foremost, stay calm. Your child will be looking at you for reassurance. If you panic, the child is going to be scared. A calm approach will help him feel safer. Next, stop the activity immediately. Don't let them try to walk or move the injured part. Any further movement can worsen the injury and cause more pain. Third, support the injured area. If it's in the arm, gently support it with a sling. If it's in the leg, try to keep it still and elevated if possible. You can also use a cardboard splint to transport the child to the hospital. Finally, seek medical attention immediately. This is the most crucial too. A suspected fracture should be diagnosed and treated as early as possible. So come to the emergency department or your nearest orthopedic clinic as soon as possible. Now let's talk about the don'ts, and this is equally important. Here is what you should absolutely avoid if you suspect a fracture. Number one, don't try to straighten the bone yourself. Resist the urge to pop it back in. You can cause further damage to the bone, the nerves, and the surrounding blood vessels. Number two, don't move the injured part unnecessarily. As mentioned before, keep it as still as possible until you get medical help. Third and most important, please do not massage the injured part. If there is a fracture, massaging can further increase the pain and swelling. It is absolutely contraindicated. Massage is for muscle soreness. It is not for suspected bone fractures. Finally, don't give your child anything to eat or drink if you think surgery is a possibility. This is because anesthesia may be required and an empty stomach is often necessary for that. To summarize, if you suspect that your child has a fracture, do stay calm, stop activity, support the injury, and seek immediate medical help. And don't try to fix it yourself or move it unnecessarily. Definitely do not massage. Remember, prompt and correct care is essential for children's fractures to heal properly and quickly. At Pinnacle OrthoCentre Hospital, we have a dedicated team experienced in treating children's orthopedic injuries. If you are ever concerned about a possible fracture, please don't hesitate to come see us. Early diagnosis and treatment can make a big difference in your child's recovery. Thank you so much for your time and stay safe.